Welcome to Sustainable Health Empowerment's Health Education Series. I'm Nicholas Tan, and I'm a pediatric hospitalist. Today's telecast is the final episode of 4, during which we will be discussing how to know if asthma is under control and what to do if it's not. In this session, we will 1. Understand how to determine if asthma is well controlled, and 2. Recognize symptoms that require emergency care. Let's take a look at how you know if asthma in you or a loved one is well controlled. Asthma is well controlled if you have symptoms no more than 2 days a week and symptoms wake you up no more than 1 to 2 nights a month. You can do all your normal activities. You don't need rescue medication more than 1 to 2 times a week. You have no more than 1 asthma attack a year that requires oral corticosteroids. Your peak flow doesn't drop below 80% of your personal best. Most people, including children, can manage their asthma, but at times you may need medical attention. Seek emergency care if you or a loved one has trouble walking or talking because they are out of breath, or if the person has blue lips or blue fingernails. This is a serious sign of a lack of oxygen. Some adjustments need to be made for different age groups. Quick-acting medications will be used to relieve symptoms in young children, whether they have asthma or not. Healthcare providers may treat young children with long-acting medications if they believe the symptoms are persistent and are likely to continue beyond the age of 6. The medications that older adults are taking may interfere with asthma medicines. Also, it is especially important to counteract effects of medications that weaken bones. Good asthma control is critical for your unborn child. Poor asthma control increases the risk a child will be born early or underweight. So, if you have asthma and are or plan to become pregnant, talk to your healthcare provider so you have a good asthma control plan. Let's review what we've learned. What may develop in older adults who use inhaled corticosteroids, especially in high doses? Weak bones, hay fever, thyroid cancer, or diabetes. The correct answer is weak bones. When should one seek emergency care for an asthma attack? When you have trouble walking and talking because you're out of breath? You have blue lips or blue fingernails? Your peak flow is less than 60% of your personal best? Or all of the above? Remember, more than one option may be correct. Yes, if you have trouble walking or talking because you're out of breath, and if you have blue lips or fingernails, which is a sign of low oxygen, you should seek emergency care. Remember, you should seek emergency care if your peak flow is less than 80% of your personal best number. It is important to remember that physical activity is important for all people and should be part of everyone's life, even if they have asthma. If activity triggers symptoms, talk to your healthcare provider about the best way to control asthma so you or your child can remain active. Let's review the important steps in how asthma can be controlled. Learn about asthma and how to control it. Follow your action plan. Use the medicine as prescribed by your provider. Identify and avoid the things that trigger your asthma, such as things you're allergic to. Remember, physical activity is important. Talk to your provider about medicines that help you stay active. Keep track of your symptoms and asthma control and get regular checkups. Today, we focused on how to know if your asthma is well controlled and when to seek emergency care. Thank you for tuning in, and be sure to check out all the episodes in this health series. We'll see you next week. Here's to good health and good habits.